So developments, what do I mean by that? What has really happened in myeloma over the last year? And I'm going to focus on three areas within those developments. A few large screening trials that have been done to help us understand the pre-myelomatous condition. I know some of you are very familiar with myeloma. Some of you don't know very much about myeloma, and that's okay. But myeloma, I could argue, is the most common cancer in the world in the sense that 5% of the adult population, if we look for it, has a monoclonal protein in their blood, has some kind of pre-myelomatous condition. So trying to understand the pathophysiology and epidemiology of that is going to be critical to understanding the disease. And we've just seen two large screening trials done. We'll talk a little bit about how we're developing in frontline therapy as we move towards more intense treatments early on in myeloma. And then perhaps the area that brings the most excitement in what's developing in myeloma is really what's coming in our emerging therapies for late stage disease or triple class refractory. After patients have been treated with the three major classes of drugs, what do we do? And now we have tremendous options. But as was noted, I have a particular passion for health disparities. And so I think it's important to talk about disparities. And so we'll discuss the importance of these disparities. And as we know, they're prolific across almost every disease, but particularly important in multiple myeloma. And just the research that was presented over these last 6 months at ASH, I think is going to be important to highlight, perhaps more important, what we're doing about it. And I'll share with you some of the work that I'm committed to doing through the International Myeloma Foundation for that. And then lastly, look, I'm just Joe, but I'm going to be a prophet for a minute, and I'm going to give you Dr. Joe's 10 predictions for the future as we think of what direction we're going into.